A warm welcome again to Dina and Mina show from Digital Health Days 2015. And right now we have a very special guest, Dr. Giulio Bognolo, who started his career as a heart and chest surgeon and is now the Chief Medical Officer at one of the biggest electronic medical record providers, which is Cerner. Welcome.
Thank you.
Giulio, it's such a pleasure to have you here. We have zillions of questions, but we will try to limit ourselves. So we will start with a question. As a global player in the field of electronic medical records, how do you find the Swedish or Nordic market different from all the other markets you are present in?
So one of the things about the Swedish and Nordic market is that it's a very mature market where digitized hospitals are very common, and the process started many years ago. So in this sense, it's advanced compared to other regions. One thing that is common, though, to all the other regions is that they have a challenge, and the challenge is that they need to move to the next step, and there is a little bit of a barriers to do that.
So would you say that over-digitalization and matureness becomes a challenge for us in Sweden?
It becomes a challenge because you have very well-established systems, and you've been doing this for many years. And now you are to the point where you have to decide what to do next. And what are you going to do with what you've done so far? You're going to continue to evolve that, or are you going to make a bold decision and move somewhere else and trying to really impact the health of your population or your citizens?
Thank you for this.
As a chief medical officer, you are supposed to be targeting lots of different issues. What are the biggest issues or concerns that you're trying to address?
So the first thing is safety. Safety and the quality of care, and they go together. Safety in the sense we want to make sure that we deliver safe care to our patients, but we also want to be very proactive in how we assess our technology and avoid introducing a new risk into the health system. So we really have a structured approach to managing clinical risk, probably quite unique amongst the vendors, and we invest a lot of time in both training and resources to keep an eye on what we do at all times. The second issue is to keep your eyes open and see what happens around, what challenges we have and all our global clients face, because what you face in the United States or in France will eventually happen in Sweden or in the Nordics. So you don't want to make the same mistake all over again, and learn from those mistakes, and from a very rich and advanced community. I think it's one of the major strengths of our company.
And it was discussed so many times during the conference this year that technology is there, technology is mature. And one of the main barriers, apart from the barriers you named, is changing people's attitude toward adopting technology. As a medical doctor, driving all the Cerner's efforts, what is your vision regarding tackling this challenge?
Well, medicine is very conservative. We heard it over and over again. I think part of the reason is how we train, and the other reason is that we really don't like to take risk because it's on the life of our patients. What we realize as a company that does business globally is that the challenges to adoption and to transformation are very similar wherever you are. So we made a very conscious decisions a few years ago to focus on the people aspect of the transformation rather than on the technical aspect. That is a given for a technical company, for an IT company. And we created a group of specialists that really are able to drive change and lead change together with our clients in the organizations and in the communities, because that is the hard part. You can have all the technology that you want. If people don't use it, it's good for nothing, really.
So if I understand you correctly, you invest a lot in educating, pioneering,
Absolutely.
promoting.
Absolutely. And creating the framework that facilitates a continuous change within the organization. This is not about the EMR, it's about how we deliver care. And if we can leave a legacy, a framework that will promote doing the right thing as the natural thing to do, then that is what I consider success. Not that I've sold the system to a healthcare organization or that they are using it a bit. I want to see it continuously improving.
Well, we hope you continue doing that because that's for the best of everybody. And we'd like to thank you for joining us today here. And
we hope that next year you will tell us some amazing news regarding innovation adoption, even on our very mature Swedish market.
Well, thank you very much for having me, and I'll see you next year for sure.
Yes, thank you.